Good afternoon, everybody, all the people that is continuing joining us in this opportunity. We will be discussing or have a wonderful panel about the role of spirituality in alcohol use among Latino communities in prevention, treatment, and recovery support. So we will have two wonderful speakers today that I will introduce shortly. My name is Yesenia Sayas Rios. I'm the program manager of the Hispanic and Latino Behavioral Health Center of Excellence. And I would like to mention that we will have a simultaneous translation today. Vamos a tener traducción simultánea al español durante el evento de hoy. So you can click the interpretation tab at the click Spanish button at the below of your web page. It's interpretation, and then you will go through one of the languages that you are willing to listen. You have English and Spanish available. Puede presionar la pestaña de interpretación que está en la parte de abajo de su pantalla y puede seleccionar uno de los dos idiomas de su preferencia. Tenemos disponible el idioma inglés y el idioma español. Now we will review our few housekeeping items. For today's event, we will have this. First of all, this event is being recorded, so all participants will be muted and cameras turned off. In order to continue the webinar, please make sure all participants to have your computer speakers are turned on and up to hear today's presentation. If you are having technical issues, it's important to let us know. So please send a message to the Hispanic and Latino Behavioral Health Center of Excellence chat box that is below of your screen. If you have a question for our key presenters, please ask or make your questions in the chat box as well. As a part of the Q&A section, we will have a space after the content to share those questions, insights, thoughts, and everything. So speakers and presenters can have the opportunity to answer those questions in the remaining time that we have left. Type your question in the chat box and hit send so we can see those questions. We will be sharing also a copy of today's presentations, and of course we will have an evaluation. So please complete the evaluation after this presentation, and the link that will be available in the chat box, but also a QR code will be available at the end of the presentation. The Hispanic and Latino Behavioral Health Center of Excellence are very committed, and part of the mission of our center is to advance and support the sustainability and behavioral health by promoting community-driven, culturally grounded, and person-centered prevention, treatment, multiple pathways of recovery, and recovery support for Hispanic and Latino. Today's presentation is very important, and it's very interesting because the dialogue of today's presentation is to explore the complex of spirituality as both as protective or maybe a risk factor for alcohol use within Latino communities. This discussion would highlight how spirituality can serve as a source of resilience and healing, while also addressing circumstances where it may contribute to stigma or barriers to seeking help. Throughout this engaging conversation, the session will consider how prevention strategies, treatment models, and recovery support services can integrate spirituality in ways that empower individuals and communities. For many individuals, we know that spirituality provides a sense of purpose, connection, hope, which is a vital component in the healing process. So, to explore the critical role of spirituality in behavioral health, recovery, and treatment, is our honor to introduce two distinguished speakers who will exemplify the integration of clinical expertise with spiritual and holistic approaches as healing. Nelly Arrieta is the first, who is part of the speakers. He has been a public service as a licensed clinical social worker for most of her professional life. She has an extensive experience with development and implementation of mental health protocols to advance treatments addressing trauma, violence against women and children, and tending to special communities in the Bay Area in California, in Salt Lake City in Utah. Nelly also graduated from the University of Utah with a Master of Social Work and a Master in Theology from Fuller Theological Seminary in Pasadena, California. She was an adjunct faculty at San Jose University College of Social Work, the College of Social Work and Counseling Psychology Department at the University of Utah. She has supervised and provided mentorship to practicum students and professionals and has worked in the mental health field for over 36 years. She is a firm believer that no one heals alone and feels a deep spiritual commitment to show up for others, especially those most vulnerable. Nelly is native from Puerto Rico. She enjoys mountain biking, hiking, swimming in the ocean, and cooking for family and friends. We also have Glory McDaniel. In May 2018, she learned Master of Arts in Clinical Mental Health Program from Denver Seminary. She is bilingual, Spanish and English. She is therapist working with specific treatment of co-occurring mental health and substance use disorders. She provides educational workshops to educate the community regarding domestic violence, trauma, substance misuse, and so much more. She is a facilitator of Men in the Soul groups for women survivors of violence, focusing on healing from physical, psychological, emotional, financial, and spiritual abuse. In 2020, she founded Crisalida, a nonprofit organization providing bilingual Spanish and English case management, peer recovery, coaching, and coaching services for victims of domestic violence, intimate partner violence, violence of crime, and of underserved population. So it's a pleasure to me to introduce these two professionals that are very committed with this topic, but more in deep in the behavioral health field. So thank you so much for being here.
Good afternoon, everybody, and thank you for the invite. We're very interested in this topic, and just as a matter of kind of beginning our conversation, I would like to ask the audience to think about yourself and to answer if you consider yourself a spiritual person. Do you consider yourself a religious person? You don't need to answer anything in the chat. It's just kind of to get you in the mood for what we're going to be talking today.
Good morning, good afternoon, everyone. Thank you for this invitation and thank you for having these conversations. This topic is very dear and near to my heart as it is part of my recovery story. Having had grown up in a very religious, dogmatic, legalistic household where we could not speak about alcohol use or substance use. Everything was just focused on religion. And then having had trauma within that upbringing that led me to substance use, alcohol use, and substance use disorder. Been in recovery for 32 years. And so it is my pleasure to openly speak about this, being that religion is part of my recovery story as well, because without it, I wouldn't be here today. So thank you for this opportunity.
Thank you so much, Nelly and Glory, to introduce yourself, but also to make this important introduction of this topic. So, because we have this panel, I would like to begin with the first question in order to begin with this information. So, why we sometimes have difficulties distinguish spirituality from religion, dogma, or dogma. Could you please speak about how these two religions, and stigma, may be different? Dogma, I believe. I'm sorry.
Let's just kind of look at the definition of religion, religio, or religare in Latin means to connect or to bind. Okay, and that's for religion. And for spirituality, I'm going to share a word in Greek. It's pneumati kotita. And this word means, pneuma means breath, spirit. It also can mean breath of life, or it could mean wind. And Glory, we have discussed this before. What do you think?
So I believe that the distinction between spirituality can be flexible and personal, right? Whereas strict religious dogma creates barriers to open discussions about substance use and recovery, right? And so what we want to explore is, we each have our version of spirituality or religiosity, right? So what are our pathways of helping one another, helping our community, educating our community regarding these different pathways?
These also have different ways to see spirituality from religion, because we know that culturally we have we have various, more than one religion. And how do you see this important factor being part of this first question? Because communities sometimes, because of their culture and what they learn when rising, and so how they can distinguish, how they can identify how this concept of spirituality or from religion specifically, it's different, even though any specific religion or specific group.
I like what Glory said, that this is all very personal. And to that's why I asked a question in the beginning. Do you consider yourself spiritual, or do you consider yourself religious? Or are you a person that practice a dogma, a religion, a way, and have a spiritual connection with maybe a higher power, or a transcendent figure, maybe? Just kind of, I'm thinking about this illustration. There was a wise sage, and he was telling, in Africa, he was telling his people that if you are alone, it's like being a stick, one stick that can be broken very easily. But if you tie three sticks together, then it's very difficult for those three sticks to get broken if they're tied together. And it kind of reminds me the way we connect with other people in community, and the importance of community. Now, how people get together and how they tie the sticks, that's the dogma. So maybe, Glory, you're smiling. You want to amplify that thought?
I'm smiling because you mentioned 3 sticks, right? Here at Crisalida, we're located in Colorado Springs. That's precisely what we do, right? When a participant or a client first enters our doors, they're connected with a case manager or resource navigator, right? So that would be your first stick, right? That will help them by doing the intake paperwork, and will help them by asking the questions of what are the resources, what are the needs, the community needs that they need, right? And then after that, we will sit down and then connect them with clinical, right? Based on their needs from the intake process with the case manager, the stick number 2 would be the clinical aspect of it, right? Where we will connect them with a clinician that will help them with their needs. And then stick number 3 would be the peer recovery coach, right? Where we also connect them with a peer recovery coach so that they can have a personal mentorship that helps them navigate their road to recovery. And so those are the 3 sticks that we put together and enlace them and help them build that support system that they so much need in their recovery process.
That's very cool. And you all need to know that we haven't talked about this before.
No.
It's very fluid, and I love the image, and I love what you do there in Colorado. That's fantastic.
That's wonderful. So based on the treatment recovery process that you now is introducing as part of this conversation, I'll now pass to the second question, that is how may spirituality relate to alcohol use in Latino?
That's
What
a
do
big
you
question.
think?
That's a big subject. I mean, and you all know that we can talk about this for 20,000 hours because it's a very amplious, big, huge field of reference. I may want to interject and kind of from a process-oriented psychotherapy perspective, and you know, I kind of find this interesting because Arnold Mindell, a psychologist, a Jungian analyst, talks about how the use of substance and alcohol creates an outer state for individuals. And he proposes in his writings that maybe the person that is struggling with alcohol or abuse of other substances is seeking, or they have a deep need to enter in an outer state, and that those people that are suffering from these problems is not just a medical or psychological problem, but it's also a deep, deep need to breathe, maybe, to connect, to transcend. And that also those people are kind of carrying the burden or carrying the shadows of their communities that are disconnected with the transcendent. Now, transpersonal psychology is a very amplious theory, but I like the way he sees the issue of the outer state in substance abuse, because if the person can start dreaming, if the person start breathing, the person may be able to recover, okay? It may resolve. It's a process of resolving this deep need for transcending, for connection, for transpersonal connection to the dream world. But the dream world is the spiritual world, the higher, maybe a higher level, a transcending place outside myself. So we all do need to sometimes transcend ourselves, and we all have experienced outer states. So this is, like I said, it's a very amplious subject, but maybe the person that is having difficulties with alcohol, it's really someone that really need to transcend and connect. and have that experience of connection outside themselves. Again, I refer to community, and I refer to the opportunity to have some kind of connection outside themselves with a higher power, with God, with Allah, with Buddha, whoever and however.
I think for me, in my personal story, the reason I turned to alcohol was because of the trauma, right? I think I used it to numb because I didn't want to feel the pain, the hurt of the trauma I had experienced of child abuse and neglect, and being sexually abused at such a young age, right? So I started my alcohol use at the age of 12. And although I lived in a very spiritual home, a very religious home, no one had an idea that I was using alcohol at that time. But for me, it was more of, I don't want to feel, right? It was more of the shame of what had happened to me. And so I want to numb my feelings, right? And so I didn't feel comfortable sharing, right? Because in my household, although we were very religious, it wasn't discussed openly that it was okay to have these conversations about trauma, about abuse, about substance use. We grew up in a very antiquated Latino, Hispanic cultural tradition where we don't have these tough conversations, right? Where we don't talk about anything negative. We hide everything under the rug, where, you know, we just turn to God and let God handle these situations. And so during my recovery, my journey to recovery, you know, I'm one of the ones that I say I am blessed because I was healed from my addiction. So I don't know what it's like to have withdrawal symptoms, right? I was healed. And so my expectation is not that every client that comes through my doors has the same healing pathway. That's not my expectation. We walk them through whatever they're going through. But the reason why I mentioned this is because, you know, we have to change our ways, right? We have to learn how to incorporate, yes, spirituality, but also these top conversations, right? Where we're educating the community, where we're having open conversations about substance use, where we're talking about alcoholism, you know, we're educating families about how this can affect us, and how can it affect our mind, our body, and our spirit. And so, yes, spirituality is very important. But having these conversations, I think, is even more important, right? Because we have to educate on resilience, on coping mechanisms, community and supports, right? And how do we adapt to having these open and clear communications with our family members, that it's okay to have these tough conversations.
Yeah, so I hear the call for coming out of the shadows for our communities. And as you know, many of our communities live in terrible shadows.
Yes.
The research also shows that for Latinos and Hispanic, the use of alcohol is less than non-Hispanic whites, but our communities get more in trouble more with the law. They lose employment. They have more health problems associated with their problems with alcohol and other drugs. And sometimes there is a higher rate of death associated to using these substances more than non-white Hispanics. That's what the research shows.
That's very interesting because I was thinking about this concept of coping strategies that Lori mentioned earlier, and it's very impressive how this concept of spirituality plays a key role as part of the treatment or recovery process. And yeah, each person is very different. Each person have different beliefs and values. So this drives me to the next question. How does stigma enters in this equation?
Big question.
Yeah. I mean,
I
go ahead.
No, Glory, you first.
Okay. So stigma and barriers to treatment, right? We have created these negative words for people who use substance use, right? Some of the words that we hear, and I know them in Spanish, like tecato or delinquent or no sirves para nada. You're never gonna end up doing anything. You're not good enough. I mean, we hear these words said from even our families, right? Again, and I speak from personal experience, right? I grew up in a home where it was told to me that I'm not smart enough, I'm not good enough, I'm never going to accomplish anything because of my substance use, right? And so that shrunk me, that stopped me from wanting to seek help. That stopped me from wanting to have a conversation about this, right? It discouraged me to seek professional help, right? And we have to like decrease that stigma that we have. We have to put that aside and say, hey, there are topics that previously in our culture we didn't want to discuss, but they're affecting us in such a way today that we have to decrease the stigma so that we can have these conversations in an open manner, right? And the better part of it is having these conversations in our churches, in our religion, in our homes, where people feel comfortable saying, hey, I think I may have a problem. Can I seek help? Where can I seek help to, instead of going to our pastor, which was my experience, and them making us feel worse for having a problem, whether it's with substance use or trauma or anything else like that.
It also kind of points to the need for faith communities to have some kind of training knowledge, some kind of awareness where they can address the stigma from within the group. If the three sticks come together, but one is a little bit bended, it's okay. We will need to find a dogma on how to tie them together so they can be together and be strong together, be a community. And I think, again, this speaks to the need of those leaders in faith communities or groups to have training, to have awareness, to really stomp out the stigma. It's really hard to pick up a phone and call for help. But if there is an invitation to come and sit together, that may work better.
And I have to add to that, right? I mean, I think we need to put our judgment aside, right? If we are religious or spiritual, right, we need to understand that God loves us all, right? Who are we to judge?
Yes.
What another person is doing? Yes. We're there to love and support them, not judge them.
Absolutely. Meantime I am listening, I am looking for different opinions and thoughts of the audience, and it's very interesting their point. I would like to share some. Carlos Galicia is mentioning something very special and important. And I said, when something is going wrong in life, spirituality disappears. What appears is someone else who indicates that having faith will fix the problem, not our effort and perseverance. And sometimes people are feeling or have those feelings, and no one's known. Other thoughts came from Cristina Castillo. Cristina is mentioning that in her opinion, I think that alcohol use in Latino is difficult to separate from culture. We don't know, see it is as a behavior, but part of the culture that it is embedded in generational trauma. It is seen as acceptable, so it's normalized. And many times it's seen as a reward at the end of the hard working week. That is the concept of normalize. So definitely the ways that the ways that we can see the behavior of the alcohol consumptions probably could be different sometimes or maybe by the culture or maybe by the behavior that as a culture we have. It's aligned with the comment of Christina. Susan is mentioning exactly, we have to go deep to what is in person going through in life and what is making the person seek dopamine and feel the grab. In Latinos, we have to understand the beliefs in the family and what is the level of education on substance use and stigma at home. It's very interesting. Thank you so much for sharing these thoughts. You can continue sharing your questions, thoughts, beliefs, and opinions. So feel free to continue sharing in the chat. Meantime, I will go ahead with our next question. And these are two questions in one. The first one, I would like to make this one. How have you seen spirituality act as a protective factor for alcohol consumption? So let's go to the first part of this composed question. So Glory, how do you see or how do you see spirituality as a protective factor for consumption or alcohol consumption?
So I believe that spirituality and religiosity play a significant role in substance use behaviors among our population, right? And so some of the protective factors are resilience and coping mechanisms, right? Studies indicate that spirituality can provide emotional support, meaning, and purpose, which may reduce the likelihood of alcohol misuse. Community and support and social supports. We rely on faith-based communities for guidance and encouragement, which can foster recovery and discourage excessive alcohol consumption, right? If we have culturally adapted treatment models, programs incorporating spirituality into cognitive behavioral therapy has shown promise and improvement treatment outcomes in Latino individuals and substance use disorder, right? We have faith-based groups like Celebrate Recovery, right? AA, a 12-step. If we have them run by community and church members, right, that can also reinforce the need and the desire of changing this negative behavior into something positive. Here at Grisalida, one of our intake questions is about religion and spirituality, right? I did graduate from Denver Seminary for a reason, and I graduated from there because I had a great clinical mental health counseling, but also because I wanted to find myself, right, as far as religion. But the reason why I mentioned that we ask these questions here when we do our intake is because if I have a client or participant that tells me, hey, can we pray in session? We're going to pray in session, right? Because it's about the client or the participant. It is not about me, right? And so the majority of everybody that works here, without it having had been planned, we all believe in God. We all have our spiritual beliefs. And so we incorporate that in everything we do, right? Based on the client need. And that's the most important part, right? That it's based on the client need. It has nothing to do with what Glory wants. It has to do everything with what the client needs.
So it's client-centered.
Yes.
And and we just need to explore with the client. There's some questionnaires that you can utilize to explore how your client feels or sense their spirituality, religion involvement. And I like what you said about cognitive therapy, because if the cognitive therapy is culturally adapted to the client's need, it have shown great results for the treatment of alcoholism and substance abuse. The research really doesn't show. I have to be, really know this research was very interesting for me, because I didn't have an updated information of this, but it really doesn't, we don't have a lot of research on how our Hispanic Latino communities respond to spirituality and the treatment or prevention of substance use and alcohol use or recovery. There is not enough research done. Most of the research show it's done in other groups. So we need research. We need to think about the client's self-determination and the openness to have willingness to adapt. And if the person wants to pray or bow or do prostrations in session because that's what they need to do, for them to integrate the work they're doing, psychologically speaking, with their spiritual need, that's okay too. We will welcome that. Why not? Why not? What stopped me from allowing someone to do their prayer in the middle of the session, or do whatever they need to do, say their mantra, or do prostrations as needed, if the person has a spiritual practice. And if not, it's okay too.
Yeah, absolutely. And is a comment from Susan, and she's sharing something very special, but also is very aligned with both of you, Nelly and Glory. And she is saying that when she is working in Puerto Rico with people in the streets and offering praying and counseling to help those who need to fulfill the spiritual needs, she also is helping with physical needs and case management. So she has this dual role, because holistic people, there is many needs in person that has been to feel it before they can identify with their spirituality, as is described in the Maslow pyramid. Is one of the basics that it's very important for each individual. So thank you, Susan, to sharing this experience from your experience. And also Susan was sharing something very special when she was growing as a Latino Catholic. And thank you for sharing this, Susan. It's impressive. Her family never talked about the difficulties or the difficult issues of their lives. Her father used alcohol to manage the issues. And many people were also alcoholics, but she could never talk about that. So different situations occur in her life, but then she is sharing that she's hating alcohol actually, and she was never she was just mental, but with their relationship with the spirituality, she was able to understand and stop being judgmental, but more understanding of the issue. So this way, thank you, Susan, one more time. This is a way that the spirituality is seen as a protective factor. And I would like to just see the other side of the question. How have you seen spirituality this time as a risk factor for alcohol consumption? So let's see the other side of the conversation.
I want to respond to, I think it was Christina who talked about intergenerational transmission of trauma. And all our communities everybody here has someone in the family that have suffered from alcohol problems or substance abuse problems. So think about intergenerational transmission of trauma and the fourth commandment in the Christian religion, in the Christian dogma. And I'm just going to make a quick comment. I'd like to make these comments just to kind of get your juices going. There was one of my heroes in the psychological world is Alice Miller. She has a book titled The Body Never Lies, recommended. And she wrote to Pope Paul II a letter advocating for children that have been abused by their caregivers, by their parents. Okay, so the fourth commandment in the Christian faith said that you need to honor your caregivers, your mother, your father. But what if those people have caused an incredible deep trauma and have destroyed the child's psychological life, their bodies too sometimes? So she wrote this long letter to the Pope, asking for the Pope to intervene and speak out to child abuse and the prevention of child abuse, based on the request that this commandment asks children to honor. But so we cannot honor. And the body doesn't know morals. The body knows what is being done to the body, okay? So think about our communities and some of the faith communities that have had difficulties with sexual abuse, physical abuse, psychological abuse. We all know historically that there is a tendency in our human ways of abusing power. So this is a big risk factor in communities of faith or groups that get together and use some kind of religious tones to address prevention, recovery of substance use and alcohol. I'm just throwing that in.
Thank you for sharing that, right? So part of my story also is about that, right? So my father was the associate pastor at a Pentecostal church. So I was a PK, a pastor's kid, for those who don't know what that means. And so it wasn't until after he passed away that I learned that my father was an alcoholic and a heroin addict before he became a pastor, right? So he went from one extreme to the next extreme, right? Where, you know, that was his past life. We never heard or learned anything about that, but that doesn't mean that it didn't trickle down in our DNA, right? Because I believe that if we would have had these conversations when I was a child, maybe a lot of things that I have experienced I would not have experienced, right? But that's aside comments, right? But him going to the extreme of religion, right, led us to not have these conversations, right? So stigma and barriers to treatment, because we could not have these conversations because they reinforce shame and guilt, right? Particularly when he found out that I was using substances and I was an alcoholic, right? And so that just revealed moral failure on my part, right? And I could not seek help, right? Because who can I turn to if my father, the pastor, was looking down on me, right? And made me feel a lot of shame and a lot of guilt, right? And so the American Journal of Public Health in 2014 found that religion stigma was a barrier to accessing formal treatment for Latinos and substance use, right? Another thing is that rigid dogma, a key distinction must be made between personal spirituality and institutional religion, right? The latter can sometimes enforce rigid moral codes, inhibiting open conversations about addiction. So in 2009, family process suggested that dogmatic approaches may increase internalized shame, while personalized spirituality fosters openness and healing. And then the third comment I wanted to make on this is NIDA. 2021 is calling for more culturally specific long-term research on the role of spirituality and relapse prevention, right? While spiritual practices correlate with short-term sobriety, there is insufficient longitudinal data on the sustained effects in recovery, right, among Latinos. And I can stand here before you and say I have 32 years of recovery under my belt, right? And that is thankful to my spirituality, my religious belief, and my treatment, my journey towards treatment, towards healing.
Wow. I have no words. It's very impressive what you are sharing. And thank you for sharing that, because this life experience is very important in order to understand the role of spirituality, even that it's a concept that is very individual for people because of their beliefs. It's different ways that it are all important. And this drives me also for this question, this last question from today's panel. So then I was wondering, how then can spirituality be incorporated in treatment and recovery process, taking or basically taking into account that spirituality could be seen different for individual, for many people. So think about this, and the people that is attending to this webinar as well, you can share your thoughts also. But how can spirituality be incorporated in treatment and recovery process? Glory.
So integrating spirituality into prevention efforts, right? Faith-based outreach, right? Church-led health initiatives can raise awareness about alcohol misuse in a culturally resonant way. We go out and we go to different churches and we educate the community in both English and Spanish about substance use, about trauma, right? And so it's a matter of continued education, right? Where we invite people, clergy members, church members, to learn more about this and openly share our experiences, right? Because it is proven that psychoeducation is the way to reach Latino congregations, right? Another way is the holistic recovery models. We just held it was called Mindfulness and Holistic Medicine, where 20 people of our community came to learn about how do we incorporate holistic medicine into our healing journeys. Where we talk about mindfulness, where we talk about guided prayer, where we talk about spiritual mentorship, right? And we incorporate that into our treatment planning and to help people who are journeying towards healing from substance use and trauma. Reducing the stigma through education, right? Programs that normalize professional help while affirming spiritual values can reduce stigma, including faith leaders and educational campaigns help bridge the cultural gaps, right? And we have to continue doing this, right? Because the more we have these conversations openly, the more we're able to help the next generation break that curse of that silence, right? We have to break that silence.
That is so true. I agree with all that. It's a big job. It's a continuous job. You know, I recently went for my physical and my doctor asked some new extra questions. One of the questions was associated to my food security and also domestic violence, if I felt safe. The question was, do you feel safe at home? And it has taken a very long time to educate the medical community to add these into the intake assessments or the assessments when someone shows up for their wellness check. Why can't we do the same in our practices in our churches, in our synagogues, in our places of worship and gathering, where we look at our lives in terms of not one piece. You're not only the person with the problem with alcohol, but you also, you also like to do these other things. You have kids, or you paint, or you are a great cook. And yes, there is some violence in your intimate relationship or with your parents. So amplifying the assessment, including maybe some of the questionnaires that evaluate where the client is. I don't like questionnaires, but there is some that might be helpful to identify if your client, this is for clinical practices, if they're interested or they have some kind of connection with their spirit and the spiritual world or a church. So education, and social media plays a big role on this. Yeah.
Yeah, and I will add that we need to normalize the conversation, right? Let's stop making a big deal out of it. Let's normalize it, right? If we have this conversation on a regular basis, then it will become normal, a normal part of our vocabulary, right? We need to engage family members, right? Include the entire family when we're having these conversations, right? One of the programs we have here is CRAFT, and it's community reinforcement on how to engage when a family member is under the influence of alcohol or substance use, right? And so we educate the community on how to work with our family members. And we need to advocate for our people. We need to advocate with representatives. We need to advocate with our churches. We need to advocate. And we also need to learn how to continue to empower every participant that walks in our doors.
Exactly. That's exactly that. Was I think about that these thoughts, because normalize the concept of incorporate spirituality as part of the treatment process is very important. Actually, I would like to share the Sahira's comment, one of our participants, and she's indicating that in Texas, as part of the wellness plan, there are the inclusion of the 8 dimensions of wellness. So it's important to talk about this concept and normalized. Yes. You know, the concept of include spirituality as part of the process. So thank you, Sahira, for sharing your thoughts. And also, I have another comment from Gladys Garay, and she is also enhancing more in deep the CDC, the NIH, and the World Health Organization consider the spirituality as part of the factors, basic factors to being healthy. So yeah, it's a very huge topic that we can continue working in this manner, but it's important to recognize that we also more than normalize and continue integrating the church and the community to the process. See the people, hear the people, and being you know, more compassionate in the process is key. Is a key part, and yeah, we need to continue this conversation in different moments. So there's another comment from Veronica Ibarra, and she thinks that the opioid epidemic has forced Latino to normalize discussion regarding the substance use disorders, and just she has mentioned that this is just the beginning. So yeah, I understand, and I see you, Veronica. All right, so let's go to different questions from the audience, if there's another questions or thoughts that you would like to share in the chat box, please feel free to continue the sharing of your questions. Yeah, I found it. Nitsa is looking for the name of the book and the author that you mentioned about I believe it was the one that Melis mentioned earlier, or Glory.
Uh-huh.
They're looking for the book, the author
Body
from the
Never
book.
Lies,
Body Never Lies.
read anything that have to do with Alice Miller. She's not longer in this planet, but she's still with me in spirit because she have really impacted my practice. She also talks about the clinician or the therapist or the counselor or the supporter to become an enlightened witness, where you sit with the person and you're kind of accompanying the person through their healing process, their journey. You're not telling people what to do, but you are kind of by them on their side. So remember, no one heals alone. I cannot be speaking here today if I would not have made a call to get therapy, support groups, all kind of things, you know. And we all deal with, minority stress. We all, if you're a woman, if you're a person of color, if you're Latina, Latino, Hispanic, if you don't speak English fluently, if you live in a world where a lot of people have resources, but your resources are limited, if you have medical problems, issues with mobility, people at home that you're caring for, single parenthood, you are in the minority spectrum, you are in the disadvantaged place. And I see part of our work as the voice for those that are more displaced or disadvantaged.
Excellent. Thank you so much for sharing all this information, your life experience, the people, the audience. Thank you so much for sharing also your experience. Thank you, Nelly. Thank you, Glory, for all this important information. And absolutely, we will have a second part of this conversation because we know that this is very important to continue exploring how spirituality is continue having an important aspect of the recovery process. So yes, we will be coordinating a second part. So stay tuned because we will invite a key person, a representative of the community or the spiritual community. So which will be focused on the influence of faith-based spiritual leaders in the prevention and recovery alcohol. So this second part will be aligned with the specific role for the person that is a leader in the non spirituality in this spiritual leadership. I mean, so continue our next events. So we will be promoting this second part very soon. And of course, thank you so much, everybody, to be here. We will be glad if you can complete the evaluation of this event. You can see the QR code in the web in the screen, and this gives us the results, as part of our work, and continue making this special and very important event. So thank you so much for completing this evaluation. This is the step before we can send you the certificate of participation. So we will be continue this conversation after.
Thank you.
Thank you all. Gracias a todos.
Thank you, Glory. We'll see you soon.
Thank you,
Muchísimas gracias.
Adiós.
Gracias a todos.
Hasta luego. See you in the next event.